might hear some loud booms in Kansas City, Kansas tonight. You're looking over the city there live tonight, where it is now legal to set off fireworks, with some safety restrictions, of course. And it's as local hospitals prepare for what's expected to be a very busy holiday. Thank you for joining us tonight at 10. I'm Brad Stevens.
And I'm Lauren Magarino. The 4th of July, now 2 days away, and with that usually comes an influx of patients. And if a recent trend holds true, that may mean doctors and nurses will be hard at work. Take a look at these numbers. The University of Kansas Health System says fireworks injuries shot up across the nation last year, with doctors treating about 6,000 more patients than they did in 2023.
Here at home, the hospital says half their burn admissions they treat are kids because they just don't know the risks. And a vast majority of all their burn patients are male. Now, to prepare, their burn unit is beefing up staffing beginning tomorrow so that they can respond to calls faster.
KCTV5's Betsy Webster is at their main campus to tell you how they are fast-tracking burn patients over the next 5 days.
They've hired additional burn center staff assigned exclusively to assisting with the emergency department. It's a temporary protocol meant to help not just the burn patients, but everyone else in the ER as well.
A trip to the emergency room with a non-life-threatening injury can mean a lot of waiting. The normal burn protocol has several steps.
Whenever a bed would come up, if they were less acute, then they would go into a room, be seen by the emergency department, and then they would decide if burn team needs to be notified to help either evaluate the wound or put a dressing on.
Because the usual burn unit staff have more than emergency visits on their plate. The added staff on fast-track days changes that.
The ER can immediately call the nurses upstairs in the burn unit to come down and respond.
Dr. Julia Slater is the medical director for the Burnett Burn Center at the University of Kansas Health System, where they treat both adults and kids. Even seemingly benign things like sparklers send many kids in with burns. Those sparklers can get as hot as a blowtorch, 2,000 degrees. The good news is kids heal from minor wounds faster than adults. But there's a bad news component, too.
Especially our younger kids, they have a lot of growing left to do, and so if they get scars early on, that can mean needing surgeries and therapy for quite a long time afterwards as they go through their growth spurts.
That means multiple surgeries, which is why she'd be thrilled to see fewer people at fireworks stands and more at professional displays. Heck, they're not just safer, but also more spectacular and usually free.
The Fast Track program begins tomorrow at 7 a.m. and goes through Monday at 7 p.m. In KCK, Betsy Webster, KCTV5 News.
Now, if you do want to set fireworks off on your own, Dr. Slater offers these suggestions. Always have water nearby, just in case. Never hold on to a firework that's already been lit. They also say if a firework was lit but it hasn't gone out, don't pick it up to check to see if it's a dud. Instead, pour water on it. Don't let kids near where you're setting fireworks off. They also advise tapping a sober person to be in charge of the show. Yeah, alcohol and fireworks, never a good combo. Now, if you